safe and you're practicing good hygiene and you're practicing social distancing. We were discussing psychological issues in special hospital settings, and we will resume from the third point, that is psychosocial issues in emergency department, as we have already discussed ICU and CCU. Emergency department is the face of the hospital, and this is the most frequently visited part of the hospital as well. And this is the introduction of a hospital basically. Whenever you try to make an opinion of a hospital, most of the time you've been to the emergency only and you make your opinion on the basis of that introduction. So therefore it is very crucial to incorporate psychosocial care in dealing with the patients who are brought to this part of the hospital, because most of the population that comes to the emergency department and goes back from there. So the emergency departments have high emotions running in them, and they have high crisis situations, and emergency healthcare professionals are often forced to handle anger, frustration, guilt, depression, dependency, and infantilization of patients and families. So the patients who are brought to emergency with a health issue and who require emergency care, they become reluctant to resume routine tasks, and the adoption of the sick role is very common in such patients. So you have to understand the environment. You are working in an environment that is rushy, that is running with high emotions, that has a lot of frustrations on the part of the caregivers and the patients, that have a lot of workload. The emotions of your colleagues, your medical colleagues, your paramedical colleagues would be high because they are working in burden. They may be burned out, overloaded, and this creates a kind of stress, and this creates a kind of low frustration tolerance as well. So it is an emergency situation where the patient is brought, and you not only have to take care of his medical problem, you have to take care of the emotions, your emotions, the emotions of the patients, the emotions of the family, and the emotions of your colleagues as well. And when you have treated the patient, you also need to take care that this patient may not develop a sick role, because most of the patients who report in emergency have an insecurity in their hearts that something has happened to us and we may not be able to do our everyday tasks like we have done in past. So you need to take care of that as well. And then the patient's family. The patient family fears the unpredictability and the outcome of the illness. They may be bothering the change of the roles and the economic burden of the treatment of the patient. The family has brought a patient to emergency and they don't know when this situation will reappear. There is an unpredictability, and they don't know the outcome of the illness. They don't know that this condition is treatable, it's manageable, or what is the prognosis. Then change of roles, like the family that has brought the patient to the hospital, that maybe they're the offsprings of a patient that has brought their father or their mother. Now their role have been drastically changed, suddenly changed roles. Previously, their mother was the caretaker, their father was the caretaker, and now they are the caretaker. This is a sudden shift in the role, and they have problems understanding and getting familiar with these roles. And then there is an economic burden. economic burden in terms of the transportation of the patients, in terms of the stay in emergency, medication, other things. So the family is at peril as well. It has fears, it has insecurities. You also need to take care of the caregivers as well in the emergency. What are the interventions? We have understood what is the situation. What is the situation that is happening with the patient medically and psychologically and emotionally? What are the problems and what is at the back mind of the attendants and the caregivers, and what is the situation in the environment with the colleagues, the burden, the stress, the hype of emotions, the hype of work. What are the interventions that are needed? First of all, keep your nerves composed and calm. Only then you can take care of the burden that is pouring into the emergency department, and you should support emotionally and psychologically to your colleague as well. Then educate the patient and the family about the medical illness, the medical condition that brought them into emergency. Keep the patient informed about the prognosis of the illness, that this will happen again, this will not happen again, it's going to go worse, it's going to go better. These are the things, these are the factors that are important in the prognosis, and so and so. Educate the patient and the caregivers that what is the probability of happening this situation again. As per situation, whatever the patient has been gone through, tell him that there is no chance that this condition will reappear, for example in accidents, in other such things. There is very less chance that a person who has met an accident will see this again. And there may be certain conditions like strokes, like other things, where there is a good likelihood that this condition may come inevitably anytime again. And there are conditions which may happen again, but they are not a medical emergency. For example, conversion reactions, psychological reactions to some adverse event of life. They may happen anytime, but they don't need an emergency admission. So always educate the patient about the nature of the situation, emergency situation they have been in, and tell them the probability of happening this. Educate the patient and the caregivers that what they should do in the situations when this thing will happen again, where they should report as per situation. Like if it's an emergency, tell them that they should report the nearest emergency facility. And if this is something that is not a medical emergency, but the patient has been brought due to the panic, tell them that this is not an emergency situation, and if this happens again, please visit your healthcare provider on the scheduled time, or you can consult OPDs of the concerned departments. So if you educate the patient properly that what they should do when this situation will reappear, it will cut down the load on the emergency department. There is a proportion of the patients that does not need to come to emergency every time they met that situation. They may report to OPDs, they may report to concerned departments, and so and so. So always educate your patient properly. Give your patient a chance to express him or herself and work through the problem with them. For example, your patient's been through an RTA. He has an experience of the trauma. With physical trauma, he has an emotional trauma of that road accident as well, and that emotional trauma also need to be heard. So always give your patient a chance what he wants to express about his situation. It will ease your patient, it will ease his anxieties, it will ease his insecurities, and it will provide your patient a sense of support. This is what you have done, and now there are inevitable things, and most of the inevitable thing in emergency departments is the assumption of sick role. As we have already discussed, the patient, due to their insecurities, believe that they are not well now when the medical condition is over. This is sick role. You should manage the sick role, and how to manage sick role has already been discussed. Educate the patient, be very scientific about it, tell him that his concerns are very well, but the medical knowledge that has been accumulated up till the time tells that the frequency of happening this is this much percent, and this is not medically explained, and it will exacerbate if you will put too much attention into it. Offer them social support. Aim for early rehabilitation and return to previous level of functioning. Whenever you discharge patients from emergency, if their medical condition allows, always encourage them to start their work. If they are students, tell them to go to school. If they are jobians, tell them to start their job. If they are women who are housemakers, tell them they should resume their everyday work. So always encourage rehabilitation, and the previous level of functioning patient goes on. A comprehensive psychosocial assessment and intervention in emergency department can prevent uncalled for admission and save the family, the patient, and the doctors from a great degree of distress and resources. This informational care will save workload, will save economic burden of your patients, will save emotional burden of your colleagues, of the patients, and of the caregivers. So always conduct a comprehensive psychosocial assessment of your patient and intervene accordingly. It will help you restore the resources, the limited resources that we have in emergency departments. So that was all for today. What you can do at hand in an ICU and how these strategies will cut down the burden for future and will help better management in future as well. So that was all for today. May God bless you. Allah Hafiz.